Mrs. Mancini has recently had abdominal surgery. It is post-op day 2, and she is continuing to experience lower abdominal pain and difficulty voiding. Mrs. Mancini has an intravenous infusion running at 50 milliliters per hour because she is unable to tolerate solid foods, and PO intake has been limited to small amounts of fluid due to the persistent nausea. Mrs. Mancini has not voided for the last 8 hours and complains of a sensation to urinate. A bladder scan reveals 630 milliliters of urine. The doctor has written an order to insert an indwelling catheter.
Hi Haley, so I'm just going to be doing my catheterization video for professional practice. So today I'm going to be using a catheter set that has actually already been opened since we did open them up from our nursing kits during the first couple of weeks of professional practice when we were learning how to do a catheter. And then I'm also going to be doing it on a female patient today. I just have the actual organ right now. Unfortunately, there were not enough mannequins, but Barb said this was okay to film with, so this is what I'm going to be doing. I'm just going to be trying to verbalize as much as I can every single step along the way. So before I would begin the actual procedure, I would talk to my client to make sure they know what's going on, to make sure that they understand that I'm inserting a catheter. So I would introduce myself. I would say my name is Allie. I'm a level 2 MoMac nursing student, and I'm going to be inserting a catheter today. Normally this has to happen if the patient hasn't voided within 8 hours, or say they're coming from surgery and they haven't been able to void, or if they've been admitted to the hospital and they haven't been able to void, or if they're completely unconscious and can't void. So for those instances, we would have to insert a catheter. So for my patient, we're just going to say that she hasn't been able to void for more than 8 hours, therefore a catheter is needed to be placed. So I would ask my patient if she has any questions at all. I would make sure I ask my patient if she's allergic to latex. As I know at my placement at St. Joe's, they do have latex catheters, so you do have to make sure that's something that you ask. If the patient isn't allergic to latex and is okay with me inserting a catheter, I would go ahead and start my procedure. So my patient doesn't have any questions, so I'm going to go ahead and do that now. Normally this plastic would be around my catheter kit, but my kit has already been opened. And I know the draping around the catheter kit is a little messy. So I'm going to go ahead and open that all up. So again, this probably is all out of order of what's like on my catheter kit and everything, just because this has all been opened before. But I would begin by putting on my sterile gloves, which I have right here, after I perform hand hygiene, which is obviously the first step. So after my hand hygiene, I am putting on my sterile gloves, trying to maintain my sterile feel as best as I can. After that, the catheter is right here. Normally it would fully be in this blue bag, but obviously this has been opened before. So I'm just going to put that to the side for a moment. And then I would begin by draping my patient. So we need to make sure that the shiny side of the drape is down. So I'm going to go ahead and open that up and tuck this underneath my patient, making sure I've got my sterile field ready. And then opening up the blue part, making sure the shiny side is on my patient, and I'm draping them accordingly. So now that I've draped my patient, I'm ready to begin cleaning. So I'm just making sure that my patient's completely comfortable and she's in the right position. So the patient does need to be in a supine position with their thighs spread apart so I can access their area so I can insert the catheter. I now have to get out my cotton balls, which I'm going to be using for cleaning, and I'm actually going to dump this whole thing of this whole clean of sterile solution on them so I can actually clean my patient. For this video, I'm not going to dump it on there because I don't want to get any sterile solution on the mannequin, but I'll just put it to the side just pretending that I've dumped it on my cotton balls. I'm then going to take my tweezers and take a cotton ball and clean from cleanest to dirtiest. By doing this, I just want to make sure that I'm not spreading anything onto my patient from their own bodily fluids. So by cleaning from the top to bottom of my patient, I'm just ensuring that nothing's being spread. So I'm taking my cotton balls and I'm just cleaning in a circular motion on my patient. And I'm going to be touching the patient with my non-dominant hand because my dominant hand is going to be used for actually inserting the catheter. So I want to try and keep this hand as sterile as I can. So I'm taking my non-dominant hand and holding my patient and taking my sterile cotton balls and cleaning my patient in a circular motion all the way down just to her anus, ensuring that she is clean. I'm going to repeat this 3 times just to ensure my patient is sterile, my patient is clean. I'm going to go ahead and go again. And I'm going to go for a 3rd time. And if I feel that I want, like say, if I feel that my patient isn't clean enough for myself, then I would go ahead and do it a 4th time. I just want to make sure that my patient is as clean as can be before I insert the catheter, just to prevent infection or anything like that. So now I'm taking my tweezers, putting those away. My cotton balls are here. They are now dirty, so I'm putting them all over there. Normally during the actual procedure, I would have put them on the non-sterile part. So now I'm ready to insert my catheter. I'm making sure that my patient is ready for me to insert my catheter. So a couple things I need to know. The catheter that I'm using, I believe it's a 14F catheter. That size is good for adults just because it will reach all the way down to their bladder. If I use anything smaller, it probably wouldn't reach, and then it would just be uncomfortable for the patient then to try and use another catheter, so that wouldn't be good. So I've got my catheter ready, and I've actually got it so in the blue wrapping. Normally, again, the whole thing wouldn't be in the blue wrapping, but for the sake of this video, it's not. So I'm opening up my catheter, having it on the sterile part of my patient, leaving it there. It's touching the sterile field, so it's not getting dirty. And I am taking my lubricant and pouring it out. So I'm using lubricant just so the catheter will go into my patient a lot easier. I want to make sure that I'm not hurting my patient or anything like that. Just by using the lubricant, everything will run a lot smoother. So I'm going to take the tip of my catheter and dip it into my lubricant that I've poured out. And then I'm ready to insert the catheter. Now, normally, you could as well. I know I've seen some nurses do it when inserting catheters. I haven't. You can inflate the balloon a little bit at the end before you insert the catheter to make sure that the balloon's not broken or anything, and to make sure everything will run smoothly. By doing that, you're just ensuring that the balloon won't break while it's inside of the patient, or it won't break while you're trying to inflate it. So after doing that, I'm ready to insert my catheter while it's lubricated. So again, with my non-dominant hand, I'm going to be touching my patient. And with female patients, it's a little difficult to find the urethra, so you're going to ask your patient to cough, so you can see where it is, and then you're going to be able to insert your catheter. So after I ask my patient to cough, I'm going to be able to insert my catheter, like so. And once I feel some resistance, or hopefully see some urine flowing out, then it looks like my catheter's in place. So hopefully right now urine is flowing out. So normally I would have a catheter bag hooked up, but I don't. So normally I would just have this here and allow the urine flowing out to go into like a little cup or something. But if urine is flowing out, then I am ready to use my 10 milliliter syringe on my patient to allow the balloon to inflate, and then my catheter should be in. So now I'm going to use my 10 milliliter balloon. My 10 milliliter syringe. Alright. And if you don't feel any resistance or anything, then the catheter should be successfully in the bladder. Now you're going to want to slightly tug on your patient just to ensure that the catheter is in, so I can feel that the catheter is in fully. And now my patient is ready to go because the Foley catheter is in successfully. So I would hook up the end of my catheter to the drainage bag, which I obviously don't have with me right now, but I would hook that up to the drainage bag to make sure that the urine drains the bag, and I would have it at the lower side of the bed at the end, just because gravity takes a place with catheters, so you want to make sure that the urine is draining it properly. After I insert the catheter, I make sure my patient isn't in any pain, obviously they may be in a little bit of discomfort because getting a catheter in isn't comfortable. So I make sure that the patient feels all right, they're not in any pain or anything. And then I would go ahead and clean up, make sure my patient is cleaned up, and remove all the sterile dressing. And then I would monitor my patient's urine output.
Mrs. Mancini has had an indwelling catheter in for 36 hours. Her urine output has been adequate, greater than 30 milliliters per hour, and she is beginning to ambulate more frequently. Her surgeon assesses Mrs. Mancini and has ordered for the catheter to be discontinued.
So now I'm going to be demonstrating how to discontinue a catheter. So using the same patient, since my patient, we're under the impression that my patient is able to void on her own, so we're going to actually remove the catheter now. So using a 10 milliliter syringe, because that's how much water that I actually put into the catheter originally, we want to make sure that all the water is out of the patient before taking the catheter out to avoid any damage to the patient. So before doing so, I'm going to make sure I explain what's going on to the patient. I want to make sure my patient understands that we're removing the catheter, and then we're going to see if they can void on their own. So after I explain to the patient what's going on, I have their permission to do this procedure. I'm then going to go wash my hands and put on my gloves, which is what I have now. And now I'm ready to start. I know some hospitals like putting a waterproof bedding underneath the patient just in case urine goes everywhere. So just for the sake of this video, I'm just going to use the piece of paper that came in with my catheterization kit. And then the only other thing I need is my 10 milliliter syringe. And as well, this normally would be connected to a catheter bag, which this portion would be connected to the catheter bag, and then this is the part that I'm actually going to be draining the water from. But let's just pretend that this portion is connected to a catheter bag, which would be at the end of the bed. But, so I'm going to make sure my patient's comfortable and everything. I'm going to go ahead and remove the catheter. So I'm going to take my 10 milliliter syringe and apply it to my catheter. I'm going to go ahead and remove the water. I can already see all the water coming out. And so once you can either check if there's 10 milliliters within your syringe, and you can also see if the part of the catheter that you're draining the water from, if it starts to fold or start looking flat, then you know that there's some resistance and you have all the water out of the catheter. So I have my 10 milliliters out, so I'm going to unhook my syringe. Now my catheter is ready for removal. So I'm going to take my non-dominant hand and just put it on my patient. I'm going to tell my patient to take a big deep breath in and out. I'm going to remove the catheter. So after telling them to take a deep breath, I'm going to go ahead and remove the catheter, which I have done, which can go straight into the garbage. And this would be connected to a urine bag as well. So I'm going to take the urine bag and take that all and dispose of it the proper way. And I'm going to dispose of my syringe as well. I'm going to make sure my patient is okay if they need anything, and then I'm going to clean them up. Just using regular soap and water at the hospital, I would just clean up my patient, just making sure that they're comfortable. Obviously, having a catheter in for however long they've had it in for, say it's been a couple days, isn't going to be the most comfortable thing, and we'd probably want to wash up after, at least in their peri area, so I'd make sure I would do that. And then yeah, so after disposing of everything, again, just ensuring my patient's okay, and then I would just continue with care after.